The following podcast is a discussion between two experts in their fields of beauty and not meant to be taken as medical advice. Be sure to consult with your doctor if you have any medical inquiries.
All right, so we're doing a mini podcast on Coolsculpting. I'm pleased to be joined by Bailey. Bailey, again, has been with me in my office for more than a year. She is a Coolsculpting University trained provider. People always ask, what is the Coolsculpting University? Is this like Harvard or something like that?
Pretty close. No, so it's actually a weekend-long training session that we did in DC. Which just goes really in depth over all of the different applicators, different types of bodies. And then we treat with the other trainers and stuff and treat each other and learn a lot. So it was very, very good. So
and I don't think they do that anymore, is my understanding. Have they cut that down?
They probably have. I'm sure with COVID and everything, it's probably, putting a pause on everything, but
so you might be one of the few or last Coolsculpting University graduates, which is actually kind of cool. And even though I say that a little bit in jest, it's actually it's a big deal because sometimes the more you know about how something works, kind of backwards and forwards, you end up treating patients differently. There's a patient that's in the news right now. I'm not sure if you've heard. She's a former model, maybe still a model, but I think her heyday was in the 90s, Linda Evangelista. So she had Coolsculpting done, not with the Elite, with the previous generation. Apparently it was done in 2016. Okay. Again, I don't know the details of this.
Yeah.
And we'll put a little disclaimer on this that I again, have not seen her, have not treated her, don't know anything about it. I did read a People magazine story on it, so I'm just doing this kind of a comment on this as an aside. So she had some issues. She did her neck, her arm, and her leg, and her stomach. So she did Coolsculpting in these areas. And then she developed fibrosis in all of those areas, which I feel really upset for her.
That's not something we ever hoped for.
And so she ended up getting multiple surgeries to correct it. And I still don't think that she's been corrected. So first of all, have you seen that in any patients?
I personally have not. The one thing I have seen from a previous office that came for a consult once, they actually had paradoxal adipose hyperplasia, where the area actually gets bigger for some reason instead of smaller. It's kind of strange looking. It kind of looks like the fat where the applicator was. You can kind of see the borders of the applicator. So it's so rare that if it does happen, the Allergan will actually pay to have it liposucked out. So I've actually seen patients come for that kind of consult.
So that patient you saw, did that patient get treated by your office where you worked before?
Yeah, she actually did.
And how did she do?
Good. It got rid of everything. And then she got a little, bonus liposuction.
Bonus lipo on that too. So. So again, I have not seen it, but of course it must exist. It's out there. It's PAH for those who don't know, and it's the dreaded complication. But from what I understand, is it's treatable. Again, I don't know the story about Linda Evangelista, but somewhere along the way, and maybe her Coolsculpting, maybe the way she reacted to Coolsculpting, and then unfortunately she's had multiple liposuctions afterwards, which weren't able to remedy it. So I don't know where she went after. And so it looks like she's had a hard lot at it, but fortunately for us, we don't really see that here. And it might have been she had an older generation machine.
Yeah, that
might have been a reaction as well.
Yeah, we're finding that the newer machines are better adhering to the skin, causing less side effects and less issues. So I don't know if that could be a contributing factor,
And they've done some update. They did this major update. So what Bailey's alluding to is there's a new version of Coolsculpting now called Coolsculpting Elite. And there's a previous version, which is regular Coolsculpting. But even the early editions of Coolsculpting, some of those machines are a little bit dated. And the newer versions would go a little colder And then the Elite, I think, is not necessarily colder, but it has more suction.
More contact to the skin for sure. So the suction, the way that the actual applicators are designed, they've had a bunch of providers kind of give feedback over the course of years from the original Coolsculpting machine. And they've kind of worked together to try and figure out how best to create applicators that fit to people's body shape better. So with that contact leads to better results because the fat is actually being cooled longer during that cycle.
I think the other thing that's cool about, not to use that pun, but the other thing I like about the new Coolsculpting Elite is that there's 2 applicators instead of 1. So before you could dual sculpt, but you'd have 2 machines in there. You've done dual sculpting with patients. You've done Coolsculpting Elite. Let's talk about the differences between the 2 of them.
Yeah, so the new modem is actually much smaller, much easier to move around the room. With the old Coolsculpting machine, I've done dual sculpting, which is where we have 2 Coolsculpting machines going at once on a patient's body. It's tough. It's very big and bulky in there. It's hard to get 2 machines with these heavy, long hoses and everything, because the hoses can definitely pull and tug on the patient, especially when they're sitting there for 35 to 45 minutes. So I really am enjoying the new Coolsculpting Elite. It's got the 2 hoses that actually disconnect from the head, which makes my job a lot easier. I feel like patients' comfort is a lot better as well. And it's just a lot easier to use. The actual hand pieces are much lighter than the original ones.
So from a patient experience standpoint, it sounds like it's better to have a Coolsculpting Elite than even if you're going to legacy devices that are like dual sculpting with 2 older devices. Some offices will do like 4 or 5 areas with legacy devices. Like, what's the most areas you think you can get a good result, but still treat patients efficiently?
Yeah. Well, we can talk about how many we were able to do at once. So I've recently treated a bunch of abdomens, which is really fun because patients are kind of surprised how fast they're able to get in and out with a full abdomen treatment. Since we can kind of treat that lower tummy area and then the upper abdomen at the same time. We could even do a love handle and a lower abdomen, or an arm and an abdomen, anything like that in combination. So it really speeds up the process in half.
So and just to kind of put that in perspective, if you're doing a lower stomach, how long does that take by itself?
It depends. If it's the smaller applicator, 35 minutes. Larger is 45.
Okay. And so if you were to do 45 plus 35 plus love handles, what's the full time for that patient to be in the office?
Maybe about 2 hours from start to finish, which normally is like 4 hours.
So you're basically cutting the time in half?
Yeah.
Oh my gosh. And I think so anytime you can get a better result for less time.
I know.
That's the idea behind it.
It's a win-win in my book.
Yeah, for sure. It's a patient experience issue, which I think is super helpful. What have we done differently in our office for Coolsculpting here? Like, you've been in our old office or new office. What's the patient experience like getting Coolsculpting aside from the Coolsculpting Elite?
Yeah, I think the overall office obviously is a lot more modern than what we were working with before. The room that we have the Coolsculpting machine in has a nice chair that uses lots of different functions, so we can get the patient really comfortable. We've got a TV in there so they can relax. They can bring their laptop with them. They can eat. They can do whatever they need while they're actually in that treatment room. And it's nice and private and quiet for them just to kind of relax while they're doing their treatment.
I think the thing I like the most about it is a window that's still private, but you can still get some sunlight in. And again, you don't feel like you're in a box. And before being in a really in a high rise, definitely I think it could be a little bit claustrophobic for patients after a while being in there versus there. I think patients, I don't mind hanging out in that room because it's so bright. And I think in general, when you have bright rooms with big windows,
we have a nice view. So
there we go.
I enjoy looking out at it.
Cool. For someone who's going to get Coolsculpting Elite, is there a way they should prep themselves for that day?
I would say bring, if you've got work to do, like I said before, bring your laptop, bring your phone. You can just hang out in there. Usually, like, comfier clothes is probably good. I would avoid wearing like jeans or something tight.
On that laptop, I've had a few patients of yours who've come in and have actually worked from home while they're getting a Coolsculpting treatment. And that's kind of one of the cooler things, that you can actually get a treatment done while you're working.
Yep.
You're plugged in, you're on your laptop. No one can tell you're getting a treatment done.
I've had patients on conference calls during it.
And I mean, what's better than working?
Not having to take time off to do it.
And exactly. So comfy clothes is another thing.
Mm-hmm.
What kind of clothes do you recommend?
Well, sometimes depending on what area we're treating, we'll get them changed into these little disposable shorts. They're really cute. But sweatpants or something that's not too tight around the abdomen if that's the area we're treating, just because it helps me kind of see the full area to treat versus where it like kind of cuts into the abdomen.
So stomach is good to have like stretchy sweatpants?
Yeah, something that you're just comfortable in.
How about legs?
Legs will probably have to get you changed into something. You could wear shorts, or we've had patients come in with like a bikini bottom on instead. Just because if we're treating inner thighs, we kind of have to have that area free of clothing.
How about arms?
Arms, tank tops work perfectly for that. No long sleeves, obviously. Come in a sports bra and a zip-up hoodie or something like that would be good.
What percentage of patients who do arms are women?
Oh gosh, I would say probably like 99%.
99.
I was almost going to say 100, but I think I have treated men in the past.
Really?
Yeah.
It seems like that seems to be more of, there's certain areas that men gravitate to and women gravitate to.
Mm-hmm.
So what is the area that almost every man comes in and treats?
I feel like lower abdomen and love handles is a really popular one for men.
There you go.
Yeah.
And what about women?
Women, I get a lot of submental, so chin. They are always concerned about the fat under their neck. And then abdomen, that lower belly pooch everybody complains of. It's always an issue.
Yeah, I think women are more complicated, right? So they want that shape. They have to have their arms exposed, that little V shape. And then, it depends on what's being exposed. So it can probably be the whole gamut. Mm-hmm. Men ever treat legs?
I don't think I've ever treated a man's legs before.
Yeah, it doesn't seem to be an area where most men get that in there. So it seems that extremities seem to be more women.
Mm-hmm.
Love handles is both men and women. Stomach is both men and women.
Mm-hmm.
And submentum, you're getting more women than men.
Yeah, I'd say I do get a fair share of men that come in too. So it's pretty common.
Is there a best candidate for submental lipo or for submental Coolsculpting?
Yeah, I think obviously they can't be like someone that's like probably a facelift candidate that's looking for a full transformation. I think stubborn pockets of fat that you feel like with diet and exercise, that fat under your chin just isn't going anywhere. I think it's a great option for you.
Yeah, I think that area, it's going to be the superficial fat, sometimes the deep fat. There's no treatment I know of that's non-invasive that treats that, but the superficial fat, excellent alternative. You've done both Kybella and Coolsculpting. What works better?
Usually my kind of route is I do Coolsculpting to debulk that area first. I think you get the most bang for your buck with that. And then if there's any little areas left over, then I'll go on with Kybella.
How long does it take for somebody to do a neck?
45 minutes.
Cool. And how long so they'll do a neck. After they do a neck, is that sore, swollen for how long?
It's really, I don't think it's that bad, honestly. A little tender maybe, a little red for that day, but swelling's not terrible.
Compare Kybella recovery to Coolsculpting recovery for submentum.
Totally different. Kybella, you kind of look like a little toad.
For how long?
Like a couple days, probably like 5 days or so. Coolsculpting, I mean, there's no bruising. There's really minimal swelling, if any. I would say more maybe just a little tenderness if you touch the area. Could be like a little bit of a numbness sensation is how patients describe it. But that's one of the reasons why I usually go with Coolsculpting first, because Kybella, they just aren't prepared for the downtime.
There we go. I think the other thing about Coolsculpting that's not talked about as much is that it does create a little thickness in your dermis. So it doesn't seem to be like creating extra laxity or more laxity that's there. So that's kind of
they have shown that the submental, it really does help kind of tighten the skin in that area as well, which is always a plus.
Cool. I keep saying that. Sorry. Excellent. So this is a little mini podcast on Coolsculpting Elite with Bailey, who is one of the few Coolsculpting University trained in the city. Thanks so much for joining us today.
Thanks for having me.
Cool. I did it again.